Folks. So in this video, I wanted to talk about HPV, and I'm actually going to read out a guide by Proactive for Her, which is a healthcare company. So let's get started. So this guide is about checking if you are at risk for HPV infection. So am I at risk for HPV infections? That is the uterus with fallopian tubes. So what does an HPV infection look like? So while HPV infections generally show no symptoms, sometimes they may show up as warts on the genital region or as an abnormal cervical smear. So it says papilloma virus. I believe that is the full form of PV in H in HPV. So papilloma virus. You can actually see this the virus, and genital warts are outgrowths or bumps on the vulva, vagina, cervix, penis, scrotum, urethra, anus, or thigh. So they might be raised or flat warts, single or numerous, little or huge. Some HPV warts can also cluster together, forming a cauliflower like shape. If you do have genital warts, your doctor can go over treatment options with you after diagnosing your condition. So that is that. So in a nutshell, okay, we'll come back to this. Let's open this up, and so we see diagnosing and treating HPV. So how it looks like, we know what does a HPV infection look like. So diagnosing and treating HPV infection, human papilloma virus is the most common sexually transmitted infection. So most HPVs are normally cleared by the body's immune system within 1 to 2 years. Progression from an initial HPV infection to disease is commonly caused due to delayed diagnosis. So, for early diagnosis, women must get their pap smear from time to time. Pap smear is a test, I believe. So, pap smears give early indications of changes in cells of the cervix. So, I think this helps with giving early indications of changes in cells of the cervix. This allows for proactive treatment before symptoms such as pain and bleeding show up. So the HPV vaccine, so this has a vaccine. So the HPV vaccine protects against high risk strains of HPVs that are responsible for a majority of cervical cancer. So looks like HPVs can also be responsible for cervical cancer. So the vaccine has high effectiveness and minimal to no side effects. So sometimes after vaccination you may experience pain, soreness or redness at the injection site for a few days, dizziness, fatigue, weakness, nausea, or in rare cases, fainting after the infection. Remaining seated for 15 minutes after the injection can reduce the risk of fainting. So, HPV vaccination is recommended for everyone from the age of 9 to 45 years of age, if not already immunized. So, even if you're sexually active and exposed to HPV virus, it is a good idea to get vaccinated. The vaccine will protect you against those HPV strains which you have not been exposed to. So there are different strains of this virus, I guess. Human papilloma virus. So yeah. And in a nutshell, we understand that human papilloma virus may be transmitted by vaginal, anal, or oral sex with someone who has the infection, even if they are asymptomatic. Basically, even if they don't have symptoms, if they have the infection, it will be transmitted by vaginal, anal, or oral sex. So HPV vaccination is recommended for all women between the ages of 9 to 45 years if not already immunized. It is also recommended for women who have become sexually active prior to taking the vaccine. So women aged 21 to 65 years are recommended screening for cervical cancer via routine pap smear. So if you're sexually active, using a condom may reduce the chances of getting HPV. However, HPV can still be passed through skin to skin sexual contact. So, if the HPV vaccine is administered before getting exposed to the virus, it can prevent genital warts and various types of cancer caused by HPV in both men and women. So, this can happen in both men and women. So, I think that is condoms. Um, and this is actually a gynecologist checking a woman and trying to understand what is going on. And yeah, that's the uterus and fallopian tube and whatnot, and a doctor and a client, and yep. So that is that. That's all the guide is. So proactive for her is on different social media websites. Apparently, they're really good. Many of my friends mention it, and my partner also experienced it. So, yep. So that's all I had for this video, talking about HPV, and trying to understand if you are at a risk for HPV by this guide from Proactive for All. That's all I had for this video. I'll see you next one. Bye bye.